Hello everyone, hope you're all doing great. This session focuses on the phases or events of cardiac cycle. Everyone feel it quite difficult to understand. So just have a look at this session. Coming to the phases or events of cardiac cycle. Let us see first about cardiac cycle. The repeated electrical and mechanical events that occur from the beginning of one heartbeat to the beginning of the next heartbeat. It is called as cardiac cycle. The duration of each cardiac cycle at a normal heart rate of 75 beats per minute. Here we have taken the normal heart rate as 75 beats per minute. 1 minute is equal to 60 seconds. So 60 seconds divided by 75 beats will be about 0.8 seconds. Before going into the phases of cardiac cycle, we must know certain terms. Only then we can understand it clearly. Systole. Systole is nothing but the contraction. Diastole is nothing but the relaxation. Isovolumetric is, iso means same, having the same volume. Here we have said volume. Iso means same, volume in the set volume. So having the same volume. Cardiac output is the volume ejected per ventricle per minute. From one ventricle in 1 minute, the volume of blood which is ejected is called as the cardiac output. At resting state, it is about 5 liter per minute. Stroke volume is the volume ejected per ventricle per contraction. From one ventricle, for one contraction, the volume of blood which is ejected, that is termed as stroke volume. The venous return. The rate at which the blood is returned to the heart is the venous return. In the previous session, we saw about the blood supply of heart. Just take a look at this session. I have given the link in the description also. If this is clear, you can understand the phases of cardiac cycle easily. This is the right atrium, this is the right ventricle, this is the left atrium, and this is the left ventricle. From the right ventricle goes the pulmonary artery, and from the left ventricle goes the aorta. Let us go to the phases now. Just consider a balloon. Okay, take a balloon and imagine in your mind that you are having a balloon in your hand and fill it with air and tie a knot. When you press from the upper portion, just a slight press, then what will happen? The air in the upper portion will go to the downward side. Just do the opposite. Press the lower portion of the balloon. What will happen? The air in the lower portion will go to the upper portion of the balloon. Something like that only is happening here. So we suppose that when the ventricles in our heart are filled with blood. What are the ventricles? They are the lower portion of the heart. Now the semilunar valves have been closed. Who are the semilunar valves? They are the pulmonary artery and aorta. Filling, now blood is filling into the ventricle through the atrioventricular valves. So from the atrium, the blood is coming into ventricle through the AV valves, and the semilunar valves have been closed. So once the ventricular filling is complete, what will happen? The AV valves will also close. Then when the ventricular filling is complete, the AV valve, what is the AV valve? The valve which is present between the atrium and the ventricle, that is called as AV valve. This also will close. So the total volume of blood contained in ventricle after complete filling at rest is 130 ml approximately. Closure of AV valves, it leads to the first heart sound, that is lub. First heart sound is because of the closure of AV valves. Okay, after the atrioventricular valves open, the ventricle begin to contract. Still the AV valves have not opened yet. I have taken one side of the heart only, right atrium or right ventricle consider, or left atrium or left ventricle you consider. Take it anything, okay? Both the ventricular valves have closed. Yeah, they have closed. So the volume of the blood in the ventricle remains same because the semilunar valves have been closed and the AV valves have been closed. The blood from the ventricle, it can't go out. So blood will remain the same. So this phase is called as isovolumetric contraction. During this phase, what will happen as the both the AV and semilunar valves have been closed, the pressure in the ventricle because of the blood, it will rise slowly. So as the pressure in ventricle at one point of time, it exceeds the outlet arteries. What do you mean outlet arteries? It is aorta and pulmonary artery. When the pressure in ventricle is more than the outlet arteries, it will cause the semilunar valve to open. So as the ventricle continue to contract, what will happen? Blood begins to be ejected rapidly into the artery after the semilunar valves open. So this is called the rapid ejection phase. Here there is more pressure, here there is less pressure. From here the pressure will go into the artery, that is the outlet artery. This phase is called rapid ejection phase. So what will happen when the pressure from the ventricle it is moving here, here the pressure will increase at certain point of time, right? So here the pressure will be low in the ventricle. So a fall in the pressure in ventricle and corresponding rise in the pressure in this artery, it will cause a slowing down of ejection of blood from ventricle into artery. So this is called the slow ejection phase. The total volume of blood ejected during rapid and slow ejection is about 70 ml at rest. So the volume of ventricle after complete ejection of blood, that is at the end of systole, it is called the end systolic volume. Now the pressure in the artery will be greater. Here the pressure will be lower because blood from here it has gone here. What will happen? The pressure in ventricle will slowly decrease as the blood is going here. When the arterial pressure, when the pressure in the artery, it exceeds the ventricular pressure, what will happen? There will be the backflow of blood into the artery. Into the ventricle. To stop this backflow of blood from the artery into ventricle, the semilunar valves will become to close. So this closure of semilunar valve can be heard on a stethoscope. It will produce depth sound. And this phase of cardiac cycle is called the protodiastole. Since the large arteries, who are the large arteries? The aorta and pulmonary artery. They are the large artery. They are elastic arteries. Because of that, they expand when blood is ejected from the ventricle into them. How do they expand? They expand like an elastic band. So the elastic recoil of artery, what it does, it ensures the blood is pushed into circulation even after ejection from the ventricle stops. This phenomenon of elastic recoil of artery, it is called Wind-Kessel effect. Do you remember this? Both the valves of the ventricle are closed. This is closed, AV valve is closed and semilunar valve is closed. What will happen? The ventricle begin to relax. The amount of blood which is left behind in the ventricle, that is after the ejection, it is about 60 ml per rest. So it is between 130 and 70 ml. Since the ventricle is relaxing with a constant volume of blood contained within it, this is called isovolumetric relaxation. First we saw isovolumetric contraction. Now it is isovolumetric relaxation. So there is a rapid decline in pressure within the ventricle. But here you need to remember one thing, that this atrial cycle, it continues. That is the venous return from the body and even the pulmonary veins. It comes to the atrium. So blood is filling in the atrium. Okay. As the atrium is filling, what will happen? The pressure in the atrium will increase. So at certain point of time, when the pressure in atrium, it exceeds the ventricular pressure, these AV valves, that is atrioventricular valves, will open. So blood now starts rapidly filling the ventricle because of the pressure gradient. Here there is more pressure, here there is less pressure. Pressure moves from the region of higher concentration to lower concentration. Okay, so this rapid filling of blood from atria to ventricle is called the rapid filling phase. The turbulence created by the flow of blood is associated with the heard heart sound. This is often not heard in healthy individual, although it may be heard in some children and young adults. The initial rapid filling of the ventricle. First, There was rapid filling phase. Now the same, what will happen? Here the pressure will be a bit more compared to the rapid filling phase in ventricle, and here the pressure will be a bit less compared to the previous phase. So because of this pressure gradient, what will happen? There will be reduced flow of blood between the atrium and ventricle. This phase is called the slow filling phase. Because of the rapid and slow filling phase of the ventricle, together it will account for about only 75% of filling, that is at the rest. The final phase of ventricular filling is that mediated by atrial systole or contraction. This is the atrial systole, this is the final phase. Systole is nothing but the contraction. So, what is happening in this phase? This phase accounts for remaining 25% of ventricular filling at rest. So which phase accounts for what filling and the percentage of filling, you must remember. Thus, the bulk of ventricular filling is not only because of the atrial contraction I have said earlier. This is due to the movement of blood along the pressure gradient only. We must not consider it or misunderstand it. So the bulk of ventricular filling is due to the movement of blood across the pressure gradient. The total volume of ventricle at the end of diastole, we call it as end diastolic volume. The turbulence created by the flow of blood into the ventricle uh, due to what? Atrial systole. It is associated with the fourth heart sound. This is rarely heard. Now summarizing the events, isovolumetric contraction. What is isovolumetric contraction? There will be constant volume in ventricle because both the doors of the chamber, that is the AV valves and semilunar valves, are closed. What is rapid ejection phase? Because of higher pressure in the ventricle and low pressure in the artery, what will happen? The semilunar valves will open and the blood from ventricle, it will go to the artery. Next comes to the slow ejection phase. Here what will happen? As the pressure compared to rapid ejection phase in ventricle, here it is slow. The blood will move in a slower speed to the pulmonary artery or aorta. This is the slow ejection phase. What is the protodiastole? Because there is more pressure in the artery, the blood will backflow to the ventricle. To prevent that blood coming into the ventricle, the semilunar valves will be closed. This is the protodiastole. And what is isovolumetric relaxation? Both the valves are closed and the ventricle is having the same volume during the relaxation time. What is rapid filling? In the previous events, what will happen in atria? The venous return will be coming into the atrium, so pressure will be more. Because of high pressure, what will happen? The ventricles will open and the blood from atria will come into the ventricle. So this is rapid filling and this is slow filling. Okay, and coming to the atrial systole. Atrial systole is nothing but the contraction of atria. For one cardiac cycle, what are the events taking place? Both the atria will contract and both the atria will relax. Ventricular systole will happen, ventricular diastole will happen. So we can tell that each cycle is nothing but the simultaneously occurring atrial and ventricular cycles. Coming to the heart sounds in cardiac cycle, first heart sound, it is love, low frequency because of the closure of AV valve. Second heart sound is dub, high frequency, closure of semilunar valve. Third heart sound is low pitched because of the turbulence of blood due to rapid ventricular filling. Fourth heart sound is high pitched due to the turbulence of blood due to atrial systole. Coming to the relationship of various phases of cardiac cycle with ventricular and atrial systole and diastole, totally there are 7 phases. We have divided into 2, that is, one is the duration of ventricular cycle and duration of atrial cycle. A systole, ventricular systole is about 0.3 seconds and ventricular diastole is about 0.5 seconds. Ventricular atrial diastole is about 0.7 seconds and atrial systole is 0.1 seconds. Just have a look at these phases. Thanks for watching. Hope you all enjoyed this session. Stay tuned for our latest updates.